Alright, team, listen up. The patient is presenting with symptoms of cerebral vasculitis, multi-system inflammatory syndrome in children and blepharitis.
Those symptoms could point to a few different diagnoses. It's not clear-cut.
I agree with Gary. These symptoms are quite complex. We need to consider all possibilities.
What about an autoimmune disorder or an infectious disease? Those could be potential causes.
I think we should run more tests before jumping to any conclusions. We need more information.
Enough. I've made up my mind. The diagnosis is hypocementosis.
Hypochementosis. Are you sure, Hawks? That's a rare condition, not commonly seen.
But if that's the diagnosis, what's the treatment plan, Hawks?
We're going to perform ganglionectomy. It's a risky procedure, but it's the only way to save the patient's life.
Are you sure about this, Hawks? It's a high-risk procedure.
I don't know, Hawks. This seems like a drastic measure. Are you absolutely certain?
Damn it. I didn't spend years in medical school to have my judgment questioned. We're moving forward with the ganglionectomy. Now, scrub up. We have a patient to save. Tracy, I need to perform a ganglionectomy on my patient. I'm almost certain they have hypocementosis.
Hawks, we can't jump to such an invasive procedure without solid evidence. Are you sure about this diagnosis?
Yes, I've been in this field for years. I know what I'm doing, Tracy.
I understand your confidence, Hawks, but we can't ignore your track record of misdiagnosis. Remember the last time you were so convinced and ended up being wrong?
That was just one instance, Tracy. I can't let that overshadow all the successful procedures I've performed. This patient needs this surgery.
I'm not questioning your skills, Hawks. I just want to ensure we have all the necessary information before moving forward. Let's run some more tests before making a final decision.
Fine, but let's not waste any time. This patient's condition is deteriorating rapidly.
Leslie, this is not looking good. The patient is in critical condition after the ganglionectomy.
Oh no, that's not what we were expecting. How are we going to explain this to Hawks? He's not going to be happy about it.
I know, but we have to focus on the patient right now. We need to figure out the best way to treat this complication.
I understand that, but we also need to think about how to communicate this to Hawks without causing a panic.
I agree, but our priority should be saving the patient. Let's work together to come up with a solution before updating anyone else on the situation.
What the hell were you thinking, Gary? You almost killed the patient with your incompetence.
I'm sorry, Dr. Hawks. I thought it was the right procedure.
Maybe we should have considered a different approach, Hawks.
Don't you dare try to deflect blame, Leslie. You were just as clueless as the rest of them.
I still think it could have been a rare condition that we missed.
I agree with Randall, Hawks. We need to consider all possibilities.
Consider all possibilities. All of you are a bunch of imbeciles. I should have never trusted any of you with this case. You all disgust me. Figure out the right diagnosis before I come back, if you even can. So, Johnson, how's everything going outside the hospital? Any exciting plans for the weekend?
Oh, you know, same old, same old. Just catching up on some reading and enjoying some downtime. How about you?
Muttering to himself. This case is really puzzling.
Sorry, what was that, Hawks?
I think I've got it. The patient's symptoms point to a rare autoimmune disorder. I need to go check on them immediately.
Wait, what? You're leaving just like that. Can't we finish lunch?
I'm sorry, Johnson. This patient needs me. I'll catch up with you later. I need everyone's attention. We have a new diagnosis to consider.
Hawks, what are you doing storming in here without Peep? Are you crazy?
This is a sterile environment, Hawks. You can't just barge in like that.
We have protocols for a reason, Hawks. You need to follow them.
Listen, hypochementosis was a misdiagnosis. It's sealpox we're dealing with here.
Sealpox, that's a rare one. What's the prognosis, Hawks?
The prognosis is not good. It spreads rapidly and has a high mortality rate if not treated promptly.
We need to act fast then. Let's get isolation measures in place and start treatment immediately.
Agreed. Time is of the essence with sealpox. Thanks, Tracy. I'm glad we finally got to the correct diagnosis for the patient.
Yes, it was a team effort. Your insight was crucial in the end.
If only I didn't have to deal with some less than competent doctors, we wouldn't have wasted so much time on the wrong diagnosis.
Hold on, Hawks. You're the one who initially diagnosed the patient incorrectly.
Well, my team could have caught that mistake if they were more attentive.
You can't shift the blame like that, Hawks. Own up to your own errors.
I don't have time for this. I'll see you later, Tracy.